Hi, I'm Tiffany Zook from the Chandler office, coming back to talk to you about allergies and specifically food allergies. This is a question that comes up a lot, definitely at my office, and I would assume at all of our locations. Do we test for food allergies? Does my child have an allergy? Every time they eat such and such food, they get a rash on their face. Or that one time that they had eggs, they got hives. Should we test? Should we test for other foods? And it's really not as straightforward of an answer as you may think. Food allergies and food allergy testing is really different from environmental allergies. Food allergy testing is notorious for having false positives, sometimes false negatives, particularly with wheat or gluten. If you've already had your child off of wheat and gluten for a period of time, sometimes they won't test positive, even if they do have an allergy. And so the other thing we want to really consider is are we talking about a true food allergy or an intolerance? Many people confuse what a true food allergy really means. A true food allergy is going to cause a reaction within minutes of ingesting the food. We're going to see hives or lip swelling, difficulty breathing, swelling of the face, sometimes profuse vomiting. For kids that have lesser reactions, say their tummy hurts when they eat dairy, or every time they have eggs, they get a little rash kind of around the face, but there's no swelling. It's more of a local rash. Those often are not true allergies. They're more of a sensitivity. And so it's important to kind of delineate, are we talking about a true allergy or are we talking about a sensitivity? Most of the time, food allergy testing is not going to pick up sensitivities. And sometimes we get these reports back and we have like 5 or 6 different positives, but they're very low level, maybe not high level. And then the question is, what do we do? Do we do anything? And usually the answer is no. Usually if your child is already eating those foods, we're going to have you continue having them eat those. If we suspect something more serious, like a reaction of lip swelling or tongue swelling or hives after eating eggs or peanuts or tree nuts, we're going to want to consider sending to the allergist. And the reason we would do that is that they have a little bit more of an expanded ability to test in a controlled environment. They also can do a food challenge. So say you go to, your child has gotten hives from head to toe or had some lip swelling after eating eggs. We send to the allergist. They'll do a little skin test, sometimes on the arms, sometimes on the back, that will tell you whether the child has a true allergy. And based on that, they can then do what's called a food challenge in their office. So they can give the child a little bit of eggs in a very small amount. Usually it's baked in something first, and assess what their reaction is and assess what their tolerance level is. We've made a big switch in the last 5 to 10 years, and rather than recommending always that you avoid foods that you're allergic to or that you have a reaction to, we're really encouraging earlier introduction, which is why we recommend doing peanut butter, tree nut butter, and eggs as close to 6 months of age as possible when you're introducing foods to your baby. And then giving regular exposure, because for those children that may have a predisposition to have one of those allergies, by starting them early and giving regular exposure, we're able to desensitize them in 80% of these kids and keep them from actually developing that allergy. If we're talking about a food sensitivity, you really want to talk with your provider about, do we avoid this food? Do we not avoid this food? What's the pro and the con and the risk and the benefit of doing so?